Hi, and welcome to the Skin Pause. I'm your host, Dr. Corinne Erickson, and today we have a guest who I am personally extremely excited about because I've only recently learned how important this issue is to me as a dermatologist. Our guest today is Dr. Tanya Goodrich. Dr. Goodrich, Tanya, is a doctor of physical therapy. She trained at UCSF, and she is the founder of the Healthy Pelvis in the Bay Area. Tanya is really dedicating her career to helping remove the stigma behind talking about pelvic floor health and helping women understand this very important part of our bodies. Thank you for being here. Welcome to the show. I just can't wait to talk with you, so let's dive in.
Thank you so much for having me. I'm so excited to talk about all this good stuff.
Well, it's so important. And I feel like the pelvic floor just kind of got skipped over in med school and then just in life and in training. And we never think about it until it's not working. And then it's really hard not to pay attention. Tell us, what is the pelvic floor and why does it start to get our attention in perimenopause?
This is so exciting. It's my favorite thing to talk about, as you'll find out. Yes, so I totally agree. So I have been a pelvic physical therapist now for over 15 years. I can hardly believe it. And I was one of I want to say like the originals, but like early on kind of devoted myself and dedicated myself to this. And it's kind of an interesting story, so I'll tell it as to how I got into this. But essentially, so I've been a dancer my whole life. I have my undergrad in dance. I thought I was only going to work with dancers out of UCSF. And during my last year in rotation, this is now 2008, I was following our women's health specialist around and going like, wait, what? What are you talking about? Like bladder, bowel, sex? Like what? And so it like kind of perked my ears because we got none of this in school, right? And then I was like, wait a second. I did some research and I was like, oh my gosh, this is so important and our country is so far behind. And so then it got me going a little bit. And then I went back to my friends in physical therapy school and I said, isn't this fascinating? And they were like, whoa, no, we want nothing to do with all that crazy, basically TMI talk. And I was like, oh, I think I'm supposed to do this. And I shifted gears. And for the last 15 years have been like primarily a pelvic and orthopedic specialist in the whole pelvis. And it's been the best decision I ever made because yes, we haven't until maybe even now have really treated the pelvic floor like you would any other part of your body, like your shoulder or your knees or back pain. It's kind of just been like swept under the rug a little bit with all these issues. And I've really just loved diving head into this and really erasing shame and stigma associated with the pelvic floor. We talk about it just like you would your shoulder, and it's been incredible to see women hear what's going on and fix it. So that's kind of my story in a nutshell, so we can dive into all the topics.
Tell me about the TMI of the pelvic floor. What are the barriers that you find in this space?
I would say that barriers are first just being allowed to talk about it openly, right? So I call this area the TMI. So I'm talking all the sexy things like leaking with cough, laugh, sneeze, or feeling heaviness or pressure in your pelvic floor. Maybe you even see it come out, or maybe it looks different than it did after childbirth. The other super sexy topics like constipation and hemorrhoids we get right into because it's all connected to the pelvic floor. Constipation is a huge issue that so many people suffer from, directly connected to pelvic floor issues. And then, of course, pain with intercourse, which can definitely happen. And we see a lot in the perimenopausal age range because there are so many estrogen receptors that live down in the pelvic floor around the urethra. And when those kind of start to decrease, you start to see major issues in this area regarding peeing, pooping, and sex.
I mean, it's the ins and outs, literally, of our health. I think we've treated it for years just like kind of the shower drain of our body. It's just where the stuff happens that we don't want to think about until it starts to break. Talk to us about this leakage issue. And I'm just going to dive in and tell you that I just started seeing a pelvic floor therapist because I was absolutely humbled and brought to my knees by the fact that as a practicing doctor, I sometimes have to run out of this room right now and can't finish your skin exam. And I know that this is not something I'm doing wrong and it's not a shortcoming, but it's taken me till age 45 to get help with it. So tell us about this.
First of all, I cannot even tell you how thrilled I am that you are opening up and sharing this, because really, again, like, you have no idea what that does to like listeners out there who really have the exact same thing, and it's so common, right? So we're going to talk about it and fix it like you would anything else. So yes, urgency. So bladder stuff becomes a huge problem. In fact, I like to joke that everybody in a friend group has someone in the group that knows where all the bathrooms are and has to go all the time. That's how common it is. Like 1 out of 4 women. And
that's me.
Yeah. So oh my God, we're going to fix it like right now. And I love that you're already getting treatment, and we'll talk about like how that experience was probably less scary than you imagined it. But essentially, normal peeing is every 2 to 4 hours. In fact, fun fact, Alfred Hitchcock based movies around a bladder because he didn't want anybody to get up. So you should be able to sit through a movie. What happens is sometimes it can get a little dysregulated and you start to go all the time or too often. And then what happens is your brain and your bladder are connected in a loop. And so you start to go at, let's say, like only 25% full, and your brain and your bladder go, oh, she loves to pee at 25% full. We're going to let her know at 25% full, and then you go. And you can see now how this vicious cycle emerges. So the first thing to know is that, first of all, it's totally retrainable. And the second thing is that you can get it back on track by knowing what normal is. So I have people kind of jot the time that you go pee. And then you have to count the length of your pee, like 1 Mississippi, 2 Mississippi. It needs to be at least 12 seconds long. Anything less than 12 seconds, I joke, is a false alarm. So it helps your brain know what normal is. And so that way, if your bladder's screaming at you and you pee and it's 6 seconds, you can be like, oh my God, that's not full nearly at all. But it felt like an emergency. So this is where that training comes in, and you literally have a conversation with your bladder, kind of like you would a toddler. You're retraining it. You're like, no, thank you for letting me know that you're starting to fill, but it's not time to go. And you literally ignore it, and you distract yourself, and you move on. And in about 5 to 10 minutes, it goes away. Isn't that wild? So that's the first thing. It's like a game changer. And then a lot of times what happens is sometimes people have urgency, which is like, yes, I better go right now. And some people have even leaking on the way. So it has to be bad and they're starting to leak. We call it like key in the hole syndrome, because it's like, panic bladder, as I call it. And again, that became more of a mental loop problem. So we have to literally stay as cool as a cucumber, because that tension literally squeezes kind of the bladder to go. So you weirdly have to do the opposite of what you think and calm it down and stay calm and quietly and calmly walk to the bathroom.
It's crazy that I feel like I'm in my 40s and I'm learning how to pee and how to like manage my pee for the first time. This is something that was told to me last week during my session, and it was like, you need to just relax those muscles. And I thought, oh my God, I'm going to do this in a safe place in a non-carpeted room in an unupholstered chair the first time I try not to do that. And you're exactly right. I did not believe it, but I can tell you it works. It worked.
We're going to have a follow-up, because this is how serious I am. In 2 weeks, you can really start to make changes. Essentially, you need to be okay with being a tiny bit uncomfortable and know that it's not hurting anything. And that's just uncomfortable retraining, but it will 100% get better, and it'll be a game changer. One of the things I love so much about being a pelvic PT is you can imagine that peeing 7 times in a day is like, sucks. It's like not okay. It's like interrupting your life. So we want to make that better. So I'm so excited that you're starting and that it's going to get better. 1 out of 4 women have this, and it really shows up in the perimenopausal age because of those hormone changes. Super, super common.
And what a metaphor for this age range, right? We have to be okay with being uncomfortable, because that's just part of it. Our bladders are changing, our pelvic floor is changing. And this does not just apply to pee, right? Women start to struggle with pooping and constipation. And I hear you have something called a poo poo ritual. What is that?
Oh yeah, the poo poo ritual. That's a crowd favorite because it really helps to understand what's going on with constipation and then have like practical tools on what to do with it. So it's a 4-step process. And the first process is in the morning is like a great time to go. It's typically when we like to see our bowels kind of start to get moving. So the first thing that really helps is drinking something hot. Drinking something hot really helps things get going. Bonus points if it is coffee, right? Gets the peristalsis moving in our gut. So that's the first thing. Drink something hot. The second thing is there's something called the I love you massage. And I don't know if you've had babies or you've seen the kind of babies that get gas and you kind of massage their bellies in that up the right, down the left fashion to help their little bellies get moving. So you do that to yourself. So essentially like I'm kind of touching the right side of my belly, but you're gonna go up the right and down the left in these kind of like big dramatic sweeps about 10 times. And that, again, helps that massage, helps get things going. I'm just going to show you my belly. I don't even know if this is going to show up, but I'm going up and down. And I can attach the poo-poo ritual for you so that your listeners can have it.
I'll put it in the show notes.
Yeah.
Great.
If you think of a baby that's gassy or needs to go, you kind of massage their legs like they're walking because they can't do that themselves. So movement is super helpful. So if you can't take a walk, you basically do like 20 high knee marches. So you can imagine that you're lifting your leg up, and just the act of lifting that leg up, your thigh is kind of massaging your colon. So a really great way to get things going. Also some deep squats. And it's not like I have to hold a weight. It's more just like you're going through the long range of motion so that you're waking up that colon. So that's like the movement component. And the last thing that I really like is adding physical heat to your belly. So either a hot water bottle or a heating pad that you lie down, because heat is another really good friend to your digestive tract. So that's kind of the 4 process that I really like people to do. If they're doing all the other things like having great hydration, and again, this is something that we see all the time in clinic, is constipation is big. Now, the reason why I want to bring up constipation too, because first of all, it just sucks by itself. And the second thing is that it adds to people that leak, it's a problem, or have prolapse. And the reason is because your pelvic floor is like a group of muscles, like a sling, that connect from your pubic bone to your tailbone. And they hold everything up. Now, if you can imagine, now you're constipated and you're adding a bowling ball to that sling, it's already adding weight to a system that isn't working well if it already leaks. So we care a lot about constipation because it will help your leaking or your prolapse or heaviness. So again, it's like one of these things where it's connected in ways you didn't think about.
This is bringing me back to when my kids were babies and I was potty training them, for one, teaching them how to go completely and empty their bladder, and then doing the I love you massage on my daughter, who'll kill me if I ever bring up that I needed to do this for her gassy baby self. If we don't pay attention to these things, what can happen? Like, what's in store for us if we are not really getting on top of this?
Oh, literally just got chills, because what I tell women, and I love talking about this, is if you didn't care about it, you will care about it now, because none of us deserve to be in diapers. And like, it literally like makes me emotional every time I say it, because women suffer in their later years and it's totally fixable and addressable like now. So if you are experiencing any dysfunction in your pelvic floor, if you're leaking, look, I'm tearing up. Like, that's how like passionate I am, because like I really want women to get it. Like, if you're leaking, if you're having pain or prolapse, like, fix it. Start fixing it now, because none of us deserve to be in diapers later.
And it feels like our destiny, and the fact that these adult diaper companies are so numerous and huge, and not just in the US, but all over the world.
It's totally treatable. It's totally preventable. And it's been so normalized in our culture. And I think that really is the root of it, is like, it's just been like shame and stigma associated with it. And once we rip off that Band-Aid and be like, no, we all suffer from this. We all care about this, and we all deserve to live like beautiful, thriving lives into our like late 90s and into our hundreds. Like, it's totally possible. And I've been getting a lot more women on my calendar now who are 70 and 80, and we're working on it. It's never too late.
Awesome.
But the earlier, the better. I'm not going to lie. Like, the earlier you get in, the easier it is to fix, just like anything, right? But yes, it's never too late. Our bodies heal especially when we know what normal is and we know how to get there, and we don't just say, oh, this is my fate, or this is inevitable that this is going to happen to me, because it's changing. And it's been really exciting actually to see. I've been in this for 15 years, and really the last 5 years has changed a lot. A lot more people are coming in. A lot more people are being familiar even with pelvic PT as an industry and being more proactive. So it's huge. I definitely have seen a huge blossoming in our field, and there's more of us, and it's just getting started. So it's a really exciting time, I think, for women's health.
It's already been life-changing for me. So that's talking about the outs of the area. Let's talk a little bit about the ins. Talk to me about sex, and why does sex become painful? I know it's multifaceted. Women are really struggling with libido. So what's going on with that?
Yeah, you nailed it. Like, if sex is not fun or it hurts, do you want to have it? No. So a lot of times you have this, we call it anticipatory pain. Like, you don't want to have it because it's painful. So we need to break that cycle. So going back to, again, everything in perimenopause often happens because of hormone changes, because you're getting that decrease in estrogen. And I like to joke that when you're young, you're in your 20s, your vagina's like an oasis. It's all moist and feels good and has all the ripples that it's supposed to. And as you get older, it turns more into the Sahara Desert, right? It's just drier, right? Things are changing now. We know vaginal estrogen cream is great. Vaginal estrogen, scream it from the rooftops, right? That's going to make your tissue literally healthier. It's literally giving it what it needs. It's so giving it that estrogen that's like the liquid gold of the vagina. That's one huge part of the recipe. The tissue has to be healthy. The other part of the recipe is that your pelvic floor, if it's anticipating pain, is not doing the right things that it's supposed to do for intercourse. So when we're ready and we're excited and we're feeling good, your pelvic floor softens, melts, and relaxes and lubricates. We need to get back into that. I call it melting butter out of your vagina. There's some universal cues that work, and that's one of my favorites to help relax the pelvic floor. Because if it's tight, it's not happening. The second thing that's part of the equation is warming it up. Sex should be considered just like any form of exercise, and it needs a warm-up, especially as we get older. Every part of the body needs more of a warm-up. There's a couple vaginal like wands or vibrators that I really like to help warm that tissue up. Your brain goes, oh, something's inside, and it's helping massage the muscle. Vibration is amazing. So warming it up, either you by yourself or with a partner. Amazing. That's part 2 of the recipe. Part 3 of the recipe needs to have lubrication. And there's so many better lubes out there than there were like in the 1980s. No more KY jelly, no more Astroglide. That stuff is full of weird chemicals. I have a whole list of different types of lubes that we recommend all the time. It's like going down a water slide without water. It has to have good lubrication so the tissue is moisturized and ready to go. That's my 3-part recipe for success. Now, if it's still tight and doesn't feel good, that's where like pelvic PT comes in. We can really evaluate you and help you with how to do all of this.
So pelvic floor PT can help you relax.
Yeah.
And train those muscles not to go into kind of fight or flight mode.
100%. Yeah. It's like a really holistic way to get your body ready for something, and you're changing that dynamic. You're going from anticipatory pain to, no, I can handle this. My body's ready for this. My body wants this. No more like gritting and bearing it anymore. Like really coming up with a much better plan so that it's enjoyable, and hopefully we're all having these thriving sex lives, and we deserve them.
Is there some truth to, when it comes to the pelvic floor and the external structures, to if you don't use it, you lose it?
Yeah, for sure. It's like anything else, right? You want to keep it moving. You want to keep blood flow happening. You want to keep muscles alive and active. Staying active, staying sexually active, that's by yourself, that's with a partner, however you want to do it, is very healthy for your pelvic floor. Orgasms are great. It keeps your pelvic floor with blood flow. It keeps everything going as opposed to not using it.
No matter what that sex life looks like for you, it's important for your health. I mean, if for no other reason, do it so that you don't have resorption of your labia, because everybody wants to keep these lips and those lips intact.
100%. Yeah, and again, there's no need to struggle or suffer. So if you're having problems, like that's where we come in to help you with all of this. If it feels too overwhelming, we'll come up with a plan so that it's not overwhelming and it's attainable and manageable in bite size.
I'll be honest, I have anxiety going in to get a pelvic exam. So when I went in to see a pelvic floor physical therapist who is amazing here in Atlanta, I was kind of nervous about what was going to happen,
For sure.
what that was going to feel like. Talk me through what a typical pelvic floor manual PT looks like for a patient.
That's such a great question, and it's totally fair because you're talking now about your pelvic floor and kind of being exposed and vulnerable. And yes, our job is to make sure that you're in a comfortable setting, that you feel safe, and it's never something that needs to just be done automatically. It's a conversation between you and the therapist. So what that first session looks like is just talking to you, getting a nice history, hearing about what's going on and what your issues are. Sometimes it's one thing, sometimes it's 4 things. We want to hear all of it. And then we're gonna do, with your clothes on, just an external check. See how your diaphragm is breathing, because your diaphragm and your pelvic floor are connected. We're gonna take a look holistically at your muscles, your ab muscles and your back. Do you have back pain? Do you have hip pain? How is all the bones connected to how you're feeling? And then typically, if there is something wrong with the pelvic floor, sometimes on that first session, we will check to see how the pelvic floor muscles are doing. Are they able to squeeze? Can they relax? Are they too tight? So it's really not just like, oh, pelvic PT is just do Kegels. I mean, that is definitely not what's happening. It's much more holistic, because what people don't realize is that sometimes people are just told do Kegels and it drives me crazy, and that's not healthcare, right? Because a lot of people are squeezing their pelvic floor and holding the Kegel all the time. So telling them just to do Kegels is not helpful. In fact, it's harmful. So getting a real sense of what your pelvic floor needs, what it looks like, and how to give you a very tailored program just for you. It's really gentle.
I'm so glad you brought up Kegels, because my whole life, I'm an overachiever. And if you tell me to squeeze something, I'm going to squeeze it hard. And so when I was trying to do Kegels, I was basically trying to juice a grapefruit, right? Like,
I love it. My
overdoing
go-getters.
it.
Yeah.
Can you talk us through the right way to do a Kegel?
So yes, so a Kegel, first of all, we don't call them Kegels in our clinic because it was named after kind of an old dude named Dr. Arnold Kegel. So we call them blueberries. We call them blueberries because it's so much better to have a visual, because you can't see your pelvic floor like your biceps. So having a visual is super helpful. You can imagine like an arcade claw, like picking up one of those toys in the arcade and dropping it. That's a perfect pelvic floor contraction because it closes, lifts, and releases. That's what our pelvic floor should be doing. Having the image of the blueberry is really helpful because you want to imagine your pelvic floor picking up a tiny blueberry and then releasing it. So we can do it together. Now I'm sitting down, which is like my favorite position to try blueberries. And I like to lean my pelvis forward so I can feel my labia right on the chair. Gives me some focus so my brain can help. Now, I joke you should be able to be in a Zoom meeting and nobody knows that you're doing blueberries because you're just isolating your pelvic floor. Nothing else should be involved. So you're just gonna kind of imagine your pelvic floor and it's picking up a tiny blueberry and releasing it. Now, if that was difficult or hard, I recommend a pelvic PT visit because that's our job, is to help you with that one activity. But that should be happening and I can really feel the close, the lift, and the release. Sometimes when I do these talks in person, I get a very brave person that raises their hand and says, I only feel it in my butt. Your real estate down there, your urethra and vagina and rectum are super close together, right? And the muscles are really connected. So I tell people, I don't care if the butt goes for the ride, but it can't be the only thing doing the work. It's like ignore your butt and really focus on the front part of your pelvic floor. That's kind of the way I like to practice. And no, you don't need to do 1,000 a day. The idea is, can it do its job? And then in real life, coughing, laughing, and sneezing, it has to help. That is how you do a quote unquote Kegel or blueberry.
I think I successfully did not juice or drop a blueberry. We've talked about estrogen, and you've brought it up about how important estrogen is for the tissues in this area. And thankfully, the black box warning on vaginal estrogen and on hormone therapy in general is gone. And as a dermatologist, this is something I talk to patients more and more about, is that we need to take care of our skin.
Yes.
And our skin includes our genital area. That is skin
Yes.
too. And we do neglect it until it's itchy or raw or breaking down or infected and something's going wrong. Talk to me about how you approach skincare down there.
Oh, so great. And I love speaking to you, the dermatologist, about this too, so we can kind of get into this a little bit. As we know now, vaginal estrogen is safe for everyone. From what I hear, 99.9% of people, even if you have a history of cancer, you just need to make sure you're seeing someone that is up to date in the research that can give you a definitive answer, not a reflexive answer that was kind of given in the past. We want that tissue to be healthy. What I have learned is that you really want to put on that vaginal estrogen like you would face cream. You want to get into the nooks and crannies. And there's an insert, and you can do that, and you can also take some and rub it on your urethra and inside the folds. That's kind of what we're telling people, so it doesn't get too goopy, like you really kind of rub it in.
I have a lot of patients skip the whole applicator part of it because it's kind of messy. I just have them do like the length from the tip of their finger to the crease of that first joint.
Yeah.
And just smear it all around and do
like
it
you would your face.
Like you would your face, and do it at bedtime. And then I have some of them put it on their face too.
Yeah.
Because there's it's not a bad idea. In fact, it's a really good idea for some women. But it's accomplishing the same thing down there that we want for our skin on our face. We want hydration and hyaluronic acid. We want collagen. We want blood flow. We want to restore a pH that doesn't harbor yeast and bacteria. Yes. That is part of our skin, and it's to be part of our bedtime skincare routine.
And you're gonna laugh at this, but I guess we care about the order. Put it on your face first, so that you're not getting your labia all over your face. Anyhow, it's kind of funny.
Absolutely. Put it on your face first.
I'm really so happy to see these changes that are happening in the last couple of years, and which is where it's so exciting to be perimenopausal now. And hopefully we're the last generation that is suffering with this. So our daughters, granddaughters, it's normalized. It's a part of care. This is what you do.
Yeah, just learning how to take care of that part of our body, because you want it to keep looking good down there, and you sure want to keep it functioning well.
Exactly. Hopefully people are now addressing it without shame and stigma. They're treating it like you would your knee, your shoulder, back pain. It's really the same, and we're treating it now in ways that we haven't before, and we care about it now so that we can live these beautiful, healthy lives. And we're treating our skin with the care and attention that it deserves.
If you could tell women one thing in their 20s and 30s before they get to this phase of life that they could start doing to maintain a healthy pelvic floor, what would it be?
I would say even if you're 20s, I would go in at least just one time in your whole life and get a pelvic PT visit just to make sure you can squeeze and relax your pelvic floor, because it's a game changer to know how it's working down there.
That's incredible. Thank you so much, Tanya. I've learned a lot. I feel even more prepared to continue on my personal journey in the space of pelvic PT and keep working on my genitourinary anxiety disorder that I've developed in perimenopause.
We're going to text because now I'm invested. I want you to feel 100% comfortable and good down there. Thank you so much. Changing lives for pelvic floors.
I want women to learn to take care of the skin. So thank you for being on board with that, because women don't just belong to one subspecialty. And just because you have one problem doesn't mean that that is only going to be a PT problem. It overlaps. And I think that's such a beautiful thing. And for us to be able to collaborate, it will help women get better faster.
Thank you so much for having me.
I really appreciate you coming on the Skin Pause. If today's conversation resonated with you, thank you for being here. If you'd like to support your skin through this season, you can visit clearaestheticsmd.com and enjoy 15% off with the code PAUSE15. I'd love for you to follow or subscribe to the Skin Pause wherever you're listening. And if you have thoughts, questions, or topics you want us to cover, leave a comment. I read them. Thanks for spending this time with me, and I'll see you next time on the Skin Pause. This podcast is for educational and informational purposes only. What we discuss on the show is not a substitute for professional medical advice, diagnosis, or treatment, and listening to this podcast does not create a doctor-patient relationship between us.